Hi, I'm Gary White for Channel 6 Central Kentucky Television, and I'm here with O.J. Stein, who is an orthodontist at Isaacs & Isaacs General Dentistry in Springfield. We're going to talk a little bit about orthodontistry and what that entails, and also what they offer here at Isaacs & Isaacs. So, first of all, Dr. Stein, tell us, what does an orthodontist do?
Well, typically an orthodontist we work with malocclusions, where your teeth come together and line up together and work properly together. We not only work with straightening teeth and getting everything to work properly together, but also with the craniofacial development. Typically, a majority of patients are kids while they're growing. We work with middle school. A lot of times that's when they're hitting a big growth spurt, and people think they come to an orthodontist just to straighten teeth. Well, it's not just the teeth, but it's also the bones that the teeth are in. So you have your maxilla and your mandible, and again you're growing, and as kids we grow and develop. You go from a little baby's head to an adult head, and in between there we were able to work with malocclusions, but also the bones that the teeth are in. I always say it's hard to get the teeth in the right place if the bones aren't in the right place. So we tend to do that as well. Typically we see kids from 7 and on up. Sometimes we'll go a little lower. It depends on if a dentist they see things and then they say, oh yeah, this doesn't look quite right or doesn't look quite ideal. You need to go see an orthodontist and have them take a look at you and see if they can help you out.
So you're talking about possibly putting on braces or doing some kind of alignments that you have, right?
Right, correct. And traditionally we've used braces for numerous years. A brace or a bracket is basically a handle on a tooth, and that's how we're able to move teeth around and grab hold of a tooth, and we use again the braces to do that. We also have aligner systems now, and it goes through a series of trays. They're aligner trays, and they move teeth slowly into position. So there's traditional brackets, and then there's aligner systems.
So for braces, can you get that at any age, or does it have to be when you're a child?
No, yes, definitely any age. And again, we're typically working with when you have your permanent teeth in, but not always. We do see some younger kids to make them, again, that growth and development to grow and develop ideally. But yes, typically traditionally our patients are maybe in the middle school range, majority of them. But I have adult patients as well. There are more and more adults who didn't get braces as a kid, and they've always wanted it and wanted to get their teeth looking nice and lined up, and they weren't able to afford it as a kid, or their parents weren't able to afford it, and now they're working and they want to get it done. So yeah, so any age really.
And how long a process is it?
You're typically it depends on severity. So it can be a limited treatment where we're just moving a few teeth around, and it may take 6 months. But you can get into more severe cases, and even into some we call surgical cases where we have to move the jaws to get things to come together. So we don't move the jaws. I would send you to an oral surgeon, but we would do braces in conjunction with that.
So it kind of varies.
It varies on the severity of the case. You look at the teeth, you look, okay, what's it going to do to get everything to come together, and you make out a treatment plan, and it's sort of like working a puzzle together. You're like, okay, how can I move this here and to get everything to come together right? So
to have the different options, so sometimes it will take the braces, and sometimes you were saying it will take the alignment treatments, correct?
Right, and you just go over. They're just options. You go over options to treat the case, and you present the options to the patient. Hey, we can do this. It's sort of what I know how to get from the from the start to the finish, and to have a good result at the finish. So,
Is there a difference between treating boys and girls?
not really. Girls tend to develop a little earlier than the boys, so maybe they may tend to have braces maybe earlier. So that's really the only difference between boys and girls.
And there's a lot of different options now. I know when I was a child, I think it had a lot of silver options for the braces, but now you have
Correct.
various different options as well that you can utilize. Is that correct?
A lot of different aesthetic values. Yes, you have your traditional stainless steel brackets, and they're still used a majority of the time. We have more aesthetic products. There's ceramic and porcelain brackets.
In different colors.
And then different colors. Oh yeah, we work with different colors. Of course, the kids, they love to have all the different colors and have all kinds of decorations on their teeth, and so yes.
And in terms of maintenance, you'll tell either the patient themselves or the parents, if it's a kid, how they can keep them clean and all that kind of
Correct.
stuff too, right? For that.
I tell all my patients the most important thing is keeping your teeth, and I'm not really worried about the braces part, but your teeth and your gums clean. I said that's the most important part about braces, believe it or not. And most certainly, we want to have a good outcome when you get the braces off, to have a nice, pretty smile when you get it done. So it's all fun and having a good time.
That's right. And you're happy when it's all over with, right?
Exactly. Yes.
What days are you here in the office?
We vary. We have it's one day a month that we come in, and it varies. It's a Friday, but it's usually around the middle of the month.
Okay. But you can come in, get looked at, and actually get the procedure done.
Correct.
Here in the office. You
Evaluate you, have an evaluation, and then yes.
Get it done all here with Dr. Stein. Thank you very much.
Yes.
Again, I've been talking with Dr. O.J. Stein. We're at I6 and I6 General Dentistry. Give them a call to schedule an appointment. It's been Gary White for Channel 6 Central Kentucky Television.